Good afternoon and welcome to our webinar on joint pain. This is Rachel Davidson speaking. I'm the Regional Coordinator for Living Healthy Champlain, and I'll be doing half of your presentation today. And then joining me for the second half will be Anna Moran, who is a registered kinesiologist, to do the talk on joint pain and physical activity. So just for a bit of background, Living Healthy Champlain is one of 14 programs across Ontario offering chronic disease support programming for people living with chronic conditions, self-management program for people living with chronic conditions. And so what we're trying to do is to support people to live as healthy as they can when living with chronic conditions. So part of these are our Living a Healthy Life workshop series. So we have one that is offered for all chronic conditions and one that is offered for chronic pain as well. And then this particular session is a series, one of 8 sessions that are offered as part of our Help with Your Health series. So these have typically been offered in person in the past, and they continue to be offered across Champlain. The Help with Your Health series is a peer-led series, and the aim of them is really to allow people to delve a bit deeper into some particular health topics, so joint pain being one of those, and to improve our health literacy and have a broader and deeper understanding of certain aspects of our health. This in turn helps us to be able to better manage our health when we do have that deeper understanding. So if you're joining us today, chances are you're involved with one of our programs, or you subscribe to our newsletter on our website, or you've attended one of our in-person sessions or one of our online workshops, which is called Better Choices, Better Health. So at the end of the webinar, we do have some links to some of the other programs, as well as some additional webinars that are coming up in the next few months. So if this is something that appeals to you and you found beneficial, you're welcome to join those other webinars as well. We do have one per month. Some topics rotate and to come up again. And then we always offer new topics as well, and each one typically features a guest speaker as well. Can everyone hear okay? All right. So this session will be recorded as well, so if you do want to go back and view it again, you're welcome to, and we'll send out the link for that to all attendees as well. So for the sound, obviously you can hear me, this is not an issue, but you want to make sure computer audio is clicked. There is a panel to the right of your screen, and that's where you will be able to adjust your sound. On your screen, you'll see a panel where you can ask questions. So feel free to ask questions at any point. You can type them in there, and I'll do my best to answer them as quickly as we can. So we will take questions there, and you can ask our guest speaker questions there also using that type box. We just have a quick poll if you don't mind answering. We just want to find out where you're joining us from today. So if you can just take a minute to answer that, you'll just find it on the in that panel box where I was just speaking to about where the questions are located as well. Thank you for taking the time to complete the poll. So I'm going to get started into the presentation. And again, if any questions come up, feel free to type those in. You won't be able to ask them via voice just because we aren't able, unfortunately, to use a telephone line right now and have it recorded. So that's something we're working on. I know it would be nice to be able to chat via the phone, so that is something we're looking at in the future. It's just right now there's a challenge of us being able to record the sound and have the telephone line. So that is why we need to use the questions with typing for now. So as I said, we're going to go into our presentation on joint pain and just give a bit of background about why we're focusing in on this. So we know joint pain is a major issue in Canada. Of the top 3 chronic conditions reported, back pain and arthritis make up 2 of the 3 conditions. Today we'll be looking at arthritis and back pain, along with some ways to help you manage these issues. If you do not experience back pain or have an arthritis diagnosis, the information presented today is still useful for many other types of joint pain. As with any illness or condition, your doctor will be able to give you the best information about your specific situation. So what is arthritis? The word arthritis means inflammation of the joints. It can result in joint pain, stiffness, and swelling. There are more than 100 types of arthritis. Some types of arthritis are caused by joint inflammation, while others can be caused by joint degeneration. If you have an arthritis diagnosis, it is important to know what type of arthritis you have so that you can learn more and have a treatment plan developed specifically for you. So these are some questions that you can certainly bring to your healthcare provider. Okay. So one type of arthritis that we'll have a brief look at is inflammatory arthritis. Inflammatory arthritis is an autoimmune disorder where an individual's own antibodies attack tissue in the lining of the joints and sometimes in other internal organs, causing inflammation, swelling, and pain. This type of arthritis in particular can affect any joint and it can start at any age, but it often begins between the ages of 30 to 60 in both men and women. Many joints are usually affected in a symmetrical pattern, so on both sides of your body. Most often the small joints of the hands and feet, wrists, elbows, shoulders, neck, spine, knees, and hips would be affected. A second type of arthritis would be degenerative arthritis. This is commonly known as osteoarthritis, and this occurs when cartilage is the tough elastic material that covers and protects the ends of bones, begins to wear away. Cartilage is an essential part of the joint. Not only does it act as a shock absorber, it also enables the joint to move smoothly. With degenerative arthritis, the cartilage erodes, eventually resulting in pain, stiffness, swelling, and causes bone-on-bone movement in the affected joint. This type of arthritis is not just a disease of the elderly, but it is more common as we age. 1 or 2 joints are affected in an asymmetrical pattern, so meaning it wouldn't be the same necessarily on both sides of your body. Most often affected are the joints at the base of the thumb, big toe, knees, hip, neck, and lower back. Once you have visited your healthcare team and you've begun your arthritis treatment plan, you need to take an active role in managing this disease. So we're going to have a look at different things that we can do to help us actually manage our arthritis. One of those is being healthy eating. Did you know that losing 10 pounds can reduce the stress on your knees by 40 pounds? So that's pretty significant. Excess weight has been proven to increase stress on weight-bearing joints such as the knees, whereas a healthy diet can help you maintain the energy you need for your work and leisure activities. Some information to help us get started with healthy eating. We'll go over a few of those tips that we can see here. So we want to eat a variety of foods, including fruits and vegetables, proteins, which could include meat, poultry, and fish. dairy products, and plenty of whole grains. We want to avoid fad diets. We're always inundated with so much information in the media, and it can be misleading and confusing. I always use the example of eggs. One day we should eat the egg whites, the next day we shouldn't. And then the following week they'll tell us that we should eat them again. So there's just a lot of confusion out there, and a lot of information that can be misleading around diets and what we should do. So if you're ever unsure, you can always consult your healthcare provider or a registered dietitian for that information. We also do have a webinar series as well, an in-person series about understanding nutrition labels, and that goes into some of these fads and myths around healthy eating. So additionally, we can maintain a healthy weight by eating regular meals with moderate portions. We can also consult Canada's Food Guide to learn more about a balanced diet and appropriate portion sizes. Another thing that we can do to help our joint health is exercise. And exercise is really the key to mobility. Regular exercise can strengthen the muscles that support joints affected by arthritis and can help you maintain a full range of motion. People with arthritis should participate in low-impact activities such as walking, cycling, swimming, and stretching, as this can help with pain management. Anna will go into this topic in a lot more detail in the second half of our presentation. Exercise also helps to keep our bones, joints, and muscles healthy. You can start to exercise at any age, even if you have not exercised much in the past. Regular exercise can reduce the symptoms of arthritis and result in less pain. It can also improve your walking, improve and maintain your mood, and help you maintain a healthy weight. Of course, we always want you to consult with your healthcare practitioner before you engage in any new exercise program, just to make sure what is safe for you and appropriate for your particular health and condition. Another piece of managing our joint health is through medications. If you do have arthritis or joint pain, medication can be an important part of managing your pain. The Arthritis Society has a comprehensive guide to arthritis medications. And of course, this is always good to discuss with your doctor or nurse practitioner, as well as your pharmacist, if you do have any particular questions about your medications. I just have a few questions. I'm just going to open these. So it says, couldn't the proteins also be supplied by plant proteins? Definitely, if you're a vegetarian and you follow a vegetarian diet, then you can certainly get your protein from that way. Again, if you have any specific questions about your diet and want to make sure that you're meeting all of your dietary needs, then certainly you can consult with your healthcare provider or a dietitian for any specific questions. There was a question about the audio. So you can just make sure that it's clicked on computer audio in the panel with the questions. So I'm just going to write that back. Okay. Another thing that we can do to help us with managing our joint pain is to manage our fatigue. So if you do have arthritis, you may get tired easily. So if you can conserve or increase your energy level by following the 5 P's of energy conservation, which we're going to have a look at now. So our first one is pacing. This is something that's covered quite a bit in our chronic pain workshop that we offer. So that's an in-person series that you can attend. They're offered across Ontario. And so they do a bit more in-depth overview of pacing. This is also included in our chronic pain webinar that we offer if that's something you're interested in joining in the future. So pacing is breaking larger tasks into several smaller ones. You do some jobs today and some another day, or you may be able to split some of your tasks to the morning and afternoon. So it's really about understanding how much you can do before you get to that point of pain. And then looking at what that timing is and always stopping before you get to that breaking point, if you will, or that point where you're experiencing a lot of pain. So that's what pacing is really about, is looking at how much you can do before you're aggravating your condition. And then incorporating rest breaks into that, so you're alternating between activity and resting. The second P is positioning. So this includes using correct posture and body positions while sitting, standing, and taking part in recreational or other activities, and even while asleep. Make sure your beds, chairs, desks, tables, and computer keyboards are at a comfortable height. So if you do work at an office, oftentimes, if you are lucky enough to have an occupational health department, they can usually come and help you set up your desk so that you make sure you have correct posture when you're sitting. More and more, we're spending a lot of time sitting, so we want to make sure that we're doing that correctly. Tell other people that you have arthritis, that they can be careful. For example, when having your hair washed at the barber or beauty salon, or you may require extra support for your neck. So not being shy and sort of standing up and for ourselves and sharing any accommodations that you may need. Our third P would be planning. So we can make a list of things that we need to do during the day. We can plan to do the most difficult tasks when we're feeling our best and are least stiff, such as just taking your pain medication or after having a bath or a shower. Keep the work you need to do close by and organized. Our fourth P is prioritizing. And so do only what you decide is most important. Eliminate less important things or ask someone to help you with them. So this can take a bit of time, but we may need to sit down and just think about, what is really most important? What do I need to get done today or this week, and what can I maybe tackle next week, so that we're not reaching that point where we're putting ourselves in pain after doing too much. Our final P is problem solving. So in order to increase our energy, reduce pain, and prevent more wear and tear on our joints, we can start by asking ourselves some of these questions. So number one, is there an easier and better way of doing this? For example, such as pushing instead of pulling, sliding instead of lifting, or using two hands instead of one. Secondly, is there a device, such as an electrical appliance, piece of equipment, or supportive splint, which would make this job easier? Again, that's something that you can ask your healthcare provider about. Number three, do I really need to do this? So concentrate on activities that mean the most to you and scale down the rest. If a task really isn't important, choose not to do it or plan to do it another time. And number four, can someone else do this for me? And if so, don't be afraid to ask for help. So we're just going to talk about back pain really briefly. Again, Anna's going to go into some of these things more in depth. So in most people, the pain and stiffness are not caused by a serious problem with the spine. Rather, the pain is caused by muscles, joints, and ligaments. While lifting or bending can trigger acute low back pain, no one really knows why some people get it and why others don't. Most people who experience an acute attack of low back pain will feel somewhat better within 2 weeks and much better within a month. In the past, people with low back pain were told to rest and limit their activity until they felt better. We now know that this approach doesn't work. In fact, too much rest may make low back pain worse and actually delay recovery. The key to feeling better sooner is to stay as active as you can. So a question you may ask is when to seek professional help. If your back pain or joint pain is severe, when it's getting worse and not better, when you're having trouble controlling your legs or bodily functions, for instance, bowel and bladder control, When you're over 50, but particularly over 65, and it's your first episode of severe low back pain, or when you have other questions or concerns that haven't been answered. So we're just going to have a look very briefly at some treatments that you may wish to pursue if you're having either joint pain or back pain. So the first one is staying active. Again, Anna's going to go over this in more detail. So staying active is key to speeding your recovery. Staying active means moving around as much as possible within the limits of your pain and trying to be more active each day. However, you shouldn't begin specific back strengthening or abdominal exercises right away. These exercises are recommended later on when your acute back pain has started to ease up. You don't need to be completely pain-free to start an exercise program. Once you're ready to start exercises, choose those recommended by your doctor or another health professional. It's also important that you learn to do each one properly. Our second treatment that we're just going to briefly highlight would be heat and cold. The application of heating pads or heated blankets is effective for short-term relief of acute low back pain. Also, clinical experience supports a role for cold packs and alternating heat and cold as you prefer. Heat or cold should not be applied directly to the skin and for longer than 15 minutes or 20 minutes at a time, with precautions to prevent burns or frostbite of the skin. It can be repeated again in another 20 minutes. So there was just a question about the difference between acute and chronic. I might refer this to, do you know the specific? Anna's just sitting next to me, so I'm just consulting her. If she knows.
After 3 months.
Okay, so that was the timeline I didn't have off the top of my head. So after 3 months, if you have a condition that hasn't resolved, that would be considered chronic at that point. So I hope that answers your question. Yep. Another treatment option would be pain relieving medication. So in most cases, using non-prescription pain relievers like Tylenol or ibuprofen, for example, like a Motrin or Advil for a few weeks is the safest and most effective way to help control acute low back pain. If you take a non-prescription pain reliever, always read and follow the directions on the package. If the non-prescription pain relievers don't help, your doctor may suggest something stronger. Excuse me. If you're over 45 or at a higher risk for stomach complications, your doctor may recommend additional medication to take alongside the anti-inflammatory drugs to help protect your stomach. Finally, we have spinal manipulation. This kind of therapy is delivered by trained practitioners, including chiropractors, physiotherapists, and some medical doctors. During the treatment, the practitioner will use his or her hands to move certain joints in your spine in a very specialized way. Spinal manipulation offers short-term relief for acute low back pain and may improve your ability to move with less discomfort. If spinal manipulation is going to be helpful for you, you should see improvement within 1 to 3 visits. So just to sum this up, the bottom line really is that you're not alone, whether you're experiencing arthritis or back pain. Low back pain is among the top 5 reasons people consult their doctors. Even though your back or joints hurt a lot, in terms of back pain, chances are that there's nothing seriously wrong with you. By managing, sorry, not for arthritis, but for your back pain, there's a good chance that there's not a serious condition. By managing your activity properly, you can expect your low back pain to improve within a few days or weeks. That being said, it's always good to consult with your healthcare provider. Most low back pain and stiffness are related to a problem with muscles and ligaments that surround and support the spine and not the spine itself. Your doctor, chiropractor, or physiotherapist will rule out any serious causes for your low back pain. Unless certain warning signs or red flags are present, you will not need a back X-ray or MRI scans or specific treatments. Normal activity will not harm your back. In fact, staying active is the key to getting better sooner. Non-prescription medications and/or spinal manipulation can help you deal with the pain when it is severe. Regular exercise may help you prevent further episodes of back pain. And the causes of acute low back pain are not well understood, but you can take steps to help yourself get over it more quickly. This will also help you take control and deal with flare-ups of low back pain if they happen. Someone just asked if ibuprofen really is the best pain reliever. That's something that I think would vary from person to person, what you might respond to. So again, any specific medication questions, I would recommend that you ask your pharmacist or your healthcare provider on what is the best option for you and your particular health condition, because I can't make that judgment call from here. But certainly if you're not sure or if you're not finding that that's effective for you, definitely talk to your pharmacist or your healthcare provider and see what may be a better option for you. So I'm going to hand it over to Anna Moran, who's our guest speaker. Anna is a registered kinesiologist with the Occupational Health Department and Family Health Team here at Briere Continuing Care. And she's going to give you an overview of physical activity and joint pain. We'll do our very best to answer your questions sort of as we go along, and then there will definitely be a few minutes to answer any questions that you have at the end of her presentation as well.
Okay. Great, thank you, Rachel. So I'm going to be focusing on the exercise component of Rachel's presentation today in a little bit more detail. So I just need to learn how this works, so click that. All right, so how can physical activity and exercise help me with my joint pain? It probably seems counterintuitive, and when you first start out, it might actually feel that way. And it's probably the last thing you want to do. But in fact, research shows it's one of the best, if not the best things you can do for your joints to manage pain. So you'll see on this slide, I have a list of the benefits of exercise. There's more than what's on this list as well. Something that people tend to experience is they need less pain medication with the same, they need less pain medication for the same amount of pain relief. They may feel decreased pain overall. They're going to see an increased joint range of motion, so you'll find that your knees and hips are less stiff. Increased muscle strength and endurance. Increased tolerance and ability to perform daily activities, so you'll experience less fatigue. Reduce risks of falls and improve balance. You might notice you have better sleep, better ability to manage stress, improve self-confidence. Exercise can also help you maintain a body weight, a healthy body weight, which decreases stress on your joints as there's less load, and decreased fatigue and increased energy overall. Before we begin, we're going to go through a quick anatomy lesson of the joint, just to help you understand the why, maybe behind why exercise is so good for our joints. So the picture's a bit fuzzy, I'm seeing, but hopefully they'll make some sense. So a joint is a connection between two bones, and we have many joints in our body. They differ a little bit, but they all have similar components. On the end of each bone, on the end of each bone is covered with cartilage, which creates a smooth surface for the bones to interact and provides shock absorption. The joint is surrounded by a capsule, which contains what's called synovial fluid, which is a lubricant which provides nutrition and lubrication to the cartilage. And then the joint's also surrounded by ligaments and muscles that help stabilize the joint. So interestingly, unlike muscles, cartilage has no blood supply. So there's no arteries or veins going into the cartilage directly. The cartilage requires the joint to be loaded and deloaded to pump the synovial fluid through it. So think of the cartilage as a sponge. When Loads are applied to the sponge. When you squeeze the sponge, the fluids are squeezed out. And when the load is removed, you release the sponge, the water is sucked back in. So the fluid sucked back in, and that's how the cartilage is fed. So just quickly with this slide to review sort of what happens when we get arthritis in a joint. There's a bunch of different kinds of arthritis. Osteoarthritis, which is a degenerative type of arthritis, is the most common form. And the cartilage on the ends of the bone degrade over time and thin and sometimes disappear, as you can see in the center picture. The joint capsule, ligaments, and muscles and underlying bone can also be affected. Inflammatory type arthritis, like rheumatoid arthritis, is an autoimmune disorder where your own antibodies attack the tissue in the lining of the joint, causing inflammation, swelling, and pain. So what can exercise do to the joint directly? So exercise increases joint stability and decreases load on the bones and cartilage. So strengthening specific muscles around the sore joint creates a natural bracing action, which takes pressure off the joint and keeps it stable. It prevents it from moving side to side. As I said before, exercise is what pumps the fluid through the cartilage, allowing the cartilage to regenerate and improving its shock absorption capacity. As well, it creates more fluid in the joint and an improved range of motion. So I like to describe it as a piece of machinery that hasn't been used for a while. The oil will become sludgy and it'll be hard to move at first, but once the machine starts moving, the oil moves through the joint and it's a lot more fluid. So we're going to be talking about exercise today in the three forms and their benefit on joint health, but we'll start with discussing the difference between physical activity and exercise, because sometimes they're used interchangeably. Physical activity refers to activities that are part of our everyday life, which may or may not increase your heart rate. Exercise is a type of physical activity which is carried out with a specific purpose and is performed to improve function. One way to increase your activity level is to focus on increasing your daily physical activities. So you might set a goal of, washing the dishes by hand, or today I'm going to vacuum the carpet, to ensure you're moving a little bit more in the day. Another way is to focus on incorporating exercise specifically into your routine, and that's what we're going to be discussing today, is that's been shown to have a lot of benefits to those with arthritis. So there are three types of exercise. There's flexibility training, which helps improve joint range of motion and mobility. There's resistance training, which builds stronger muscles to protect your joints and meet the demands of your daily life. And there's aerobic exercise, which increases your fitness so that you have more energy throughout the day. And we'll go into each one in detail in the next few slides. So flexibility training are activities that include range of motion exercises and stretches. So range of motion exercises help to maintain or restore normal joint movement and relieve stiffness. So range of motion exercise, you're moving the joint through its range of motion as much as you can tolerate within your pain. Stretching exercises help maintain or restore normal flexibility to the joint's muscles and tendons. They're the type of exercise where you're holding the position for a longer period of time. While you hold them, what happens is the stretch receptors in the muscle relax, which in turn allows sustained lengthening of the muscle fibers. And tight and short muscles are major contributors to arthritic pain. Usually, it's recommended that you start with range of motion exercises and then add static stretching in as your tolerance increases. Also, if you're having a day where your joint pain has been flared up, you should still move your joint through its range of motion every day. So maybe that day you're not going to be doing your daily walk because you're in too much pain. You should still try and do some range of motion exercises at least once daily. When we're doing the static stretching, you want to make sure you're performing them when the muscles are warm. So some ways to do this is take a hot shower, bath, or use a hot pack, or you can do your stretching after your walk where your muscles will be warmer. You want to avoid stretching, static stretching, if the joint is hot, swollen, or you have a flare-up of pain. You also want to avoid any sort of bouncing or jerking. You want all your motions to be very smooth and fluid. And sometimes people find stretching in the pool easier way to stretch because your body weight's supported. So both stretching and range of motion exercises are sort of the prelude to strengthening and aerobic exercises, which I will talk to in the next slide. Also good to note that at the bottom of this slide, I have a link to the Arthritis Society's website, and on that website they actually have a tool that has pictures of different stretches you can do if you're wondering what stretches you should do. It will vary on your needs, but it's a good guideline as a basic introduction. So resistance exercises work by increasing muscle strength around the joint. As I said, this increased strength provides a natural brace around the joint, which helps to take the load off the bones and cartilage. It also helps keep the joint stable and in proper alignment during movement. Is there a question? Okay. Note that strength exercises, resistance exercises, should be performed with correct form and alignment to be beneficial. We want to make sure our form is good because we want to strengthen the muscles in the correct direction. I'm going to go back to the flexibility slide because I realized I forgot some stuff on that slide, and then we'll come back to this. Okay, so so frequency. So for flexibility training, frequency, you want to start with every second day to allow your body some time to recover and slowly get used to it. But you definitely do want to build up to a daily routine. You want to begin with a gentle range of motion and slowly increase that range of motion as tolerated. So for range of motion exercises, you're holding the movement at the end range of the motion for about 1 to 3 seconds, and you can repeat that 5 to 10 times. For stretches where you're holding that static stretch, you want to hold it for about 10 to 30 seconds and repeat it 2 to 3 times per muscle group. And as I said, the types of exercises, we have range of motion exercises, which can be done in standing or lying. And we have stretches, which are usually done in a non-weight bearing position, such as lying or sitting.
Could you give an example of what you mean by range of motion exercise versus a stretch?
So a range of motion exercise for the knee could be in sitting, straightening your leg out straight as much as possible, or if you're standing up, trying to bend your knee to bring your heel towards your buttocks would be 2 examples of knee range of motion type exercises. So back to resistance training. The frequency you want to do for resistance training is you want to start with about twice a week. Non-consecutive days, so you want some rest days in between. The recommendation is between 48 to 72 hours between sessions. Again, during this time, you would still continue with your flexibility training, which would be done daily. If you can, you want to progress your resistance training to 3 sessions a week, though 2 sessions a week has been noted as beneficial as well. So you want to start with light resistance at first and build up your tolerance from there, and then build up your resistance. So it's better to start out with light weight, light resistance. So resistance can be your body weight, it can be a TheraBand, it can be a free weight that you're holding in your hand. It's better to start off too light than too heavy and have too much muscle pain afterwards. You want to build up your tolerance to that resistance so that you can do about 10 to 12 repetitions. And then once you're able to do that, you can slowly increase the resistance. Oh, I'm not, no.
So Anna's not directly familiar with the Moving Easy program. So what that is a program that's incorporated into our chronic pain workshop. So that's part of that. So definitely the Moving Easy program could be part of that flexibility training, as well as that really that nice light program. So that's sort of where that would fall. It wouldn't fall under the other 2 categories. So it wouldn't be resistance or aerobic training, which Anna will cover in a minute. So yes, to answer your question in a long-winded way.
So the Moving Easy program is a good program for flexibility training. Okay, great. Sorry, intensity. So start with light resistance and then build from there as your tolerance improves. So ideally you want to work up to doing an exercise for 10 repetitions, and you want to do 3 sets of 10 repetitions for each muscle group. Okay, and then that would ideally be done 2 to 3 times a week. Once you're able to do 10 to 12 repetitions, then it becomes easy. It's time then to increase the amount of resistance you're working against. Time, you want to slowly build up, as I've been saying. So you start with 1 set, then progress to 2, and then 3. You want to avoid any sort of high repetition. I mean, nothing more than 15 repetitions or anything where you're pushing against a really heavy resistance. If that day your joint is slightly swollen or a little bit painful, you want to cut down on the number of repetitions you're doing to, I know, about half or whatever you can tolerate for that day. But if your joint is hot and swollen and painful that day above your baseline pain, you might want to avoid your resistance exercises for that day and stick with your range of motion and flexibility exercises. So type of exercise. So there's 2 different types of resistance exercise. There's dynamic. So that's exercise that moves the joint through its range of motion against resistance. The muscle shortens as it contracts and elongates as it stretches. This is the best kind of resistance exercise to build strength. Isometric exercise tightens your muscles without actually moving the joint. These types of exercises are really good on days when you're having increased pain. So an isometric exercise could be you're standing close to the wall and you're trying to push your elbow into the wall, but your arm's actually not lifting away from your body because the wall is holding it in place, but you can still feel your shoulder and arm muscles contracting. That's an example of an isometric exercise. Dynamic exercise would be something like a squat or a chair sit to stand. Yoga, Tai Chi, and Pilates can also be good sources of exercise that promote balance and strength, though there are some positions in those types of programs that you may want to avoid, and you definitely would want to avoid anything that would require you to hold a position for too long a period of time. So I'm seeing a question that says, could we also do something like water aerobics, water yoga, using the water as resistance? Definitely, for sure. Water creates natural resistance, and also it's non-weight bearing, which is sometimes better tolerated. I do speak to that a little bit more in the aerobic component, but there is a component of water aerobics that is strengthening as you are moving your limbs through water, which is creating resistance. Though it's more of an aerobic and endurance exercise on your muscles versus a pure strength type of exercise. And again, at the bottom of this slide is a link to the Arthritis Society's webpage, which also has some sample exercises there as well. So aerobic exercise helps to decrease the fatigue you might feel during certain activities or by the end of the day. It does this by strengthening your heart and lungs so that your stamina and tolerance is increased. It can also help with weight management, resulting in less load through your joints. Research has shown that aerobic training especially benefits those with chronic pain, such as fibromyalgia as well. So the frequency of aerobic training. So should I speak to that right now? Sure. So someone had a question related to the last slide. So where can I find examples of isometric exercises? So as I said, the link at the bottom of the slide to the Arthritis Society has some sample exercises there. Yeah, I would recommend going there for that. So back to aerobic training. Frequency. So again, we want to really start out slowly. So I would recommend starting out twice a week, again, non-consecutive days. But ideally, you do want to progress to about 4 to 6 or 7 days a week of doing some sort of cardiovascular exercise. If you can't tolerate long bouts of aerobic exercise, you can do shorter bouts but more frequently in the week and slowly increase your time as you can tolerate. The intensity is recommended that the amount of effort you're exerting during this type of exercise is moderate. So you should feel like you have a greater increase in breathing rate. You can still talk, but you definitely would not have enough breath to sing. Okay, if you cannot talk while you're doing your aerobic exercise, you're definitely working too hard and should slow down. And if during the exercise you should feel chest pain, pressure, shortness of breath, dizziness, nausea, stop exercising and sit down. It should go hopefully away. If it doesn't, then you should report to emergency. If those symptoms go away but return each time you exercise, you should see your primary provider. A safe level of exercise will depend on your health. It's recommended you start out with low intensity and slowly build from there up to moderate intensity. So time, ideally you want to work up to be able to tolerate 20 to 30 minutes. You can start with, as I said before, shorter bouts of exercise, 1 to 2 times per day. Sometimes it's better tolerated if the exercise is broken up into smaller bouts and you can have some rest time in between. From there you can progress to 2 bouts of 10 minutes a day, then 1 bout of 15 minutes, and then slowly increase by 5 minutes as tolerated until you're up to about 20 to 30 minutes at one time. Again, if you're not able to tolerate 20 to 30 minutes at one time, splitting it, keeping it at 10 to 15 minute bouts 2 times a day will also get you the results that you're looking for. So, type of exercise, you want what's called low impact exercises, such as walking. So before I talk about types of exercise, I'm just going to read out a question. So would HIIT workouts be okay or not a good idea? What you just said kind of sounds like a modified HIIT program. So HIIT is a high intensity interval training. It's a type of exercise that's become more popular now. It's where you do really high intensity bouts of exercise for short periods with a short break in between, and then you do it again. I would not recommend HIIT type of exercise for someone with a joint issue, as it usually requires vigorous exercise that's usually a bit higher impact. So I guess, you know, I am saying split your exercise into shorter segments, but what I mean by that is keep the exercise. So let me give you an example. So if you're doing a walk and you cannot tolerate 20 minutes, but you can, because you have too much pain, but you can tolerate about 10 minutes, what I would recommend to do is a 10-minute walk in the morning and then a 10-minute walk later in the day. You could also try, you know, doing a 10-minute walk, waiting a couple of minutes, and then maybe a 10-minute bike because it's a slightly different exercise. But yeah, I wouldn't recommend HIIT workouts, high-intensity workouts for anyone with a joint issue. So type of exercise, so sort of speaking to what I'm talking about right now. So walking, cycling, either indoors or on a stationary bike, water aerobics, Nordic pole walking are all good examples. Walking's, you know, easy, convenient, low cost. It's a great way to counter the sitting position that we're in for a lot of the day, especially when we're having chronic pain. When you do walk, you want to ensure you have proper footwear that has good arch supports and are flexible and has good cushioning. Another example would be cycling. If you do have back pain, you want to make sure that you adjust the handlebars up higher so that you're not bent over as much, and that the seat height is at a height that allows a slight bend in your knee when the pedal is at its lowest point. The recumbent bike, which is the type of stationary bike that sort of looks like they're sitting in a chair, I don't know if you've seen that before at the gym, is sometimes better tolerated for people with knee and back pain. The angle at the joints are a little bit less. Water aerobics is great. It allows you to exercise without putting joints under strain and your body weight's supported. They recommended a water temperature between 26 to 32 degrees. So you don't want to be doing it in really cold water temperatures. Nordic pole walking is a great option. That's the, I don't know if you've seen people around town, but that's the walking where they have those poles in their hands. It provides a more full body exercise because it uses your upper body, and the stability of the poles can also, you know, provide some help with balance if you're worried about falling. Another option would be to do what's called cross training, so alternating activities. It may be better tolerated, especially as you increase the amount of exercise you're doing, as it varies the joints and muscles being used. So cross training would be one day I go for a walk, and then the other day I'm going to do a bike, as those use different muscle groups and put your body in different positions, so different joints are being loaded. You definitely want to avoid activities that require jumping, rapid twisting, turning, sudden stops, because that can be fairly stressful in the joints. So activities such as jogging, high-impact fitness classes, racket sports, or contact sports should be avoided. So, is it okay to exercise when it hurts? You don't. I tap into heaven.
Sorry.
That's
I took a lovely
diagram
away from it.
It's a beautiful picture. So I did have a little picture of a line with the numbers 0 to 10. It's a pain scale, which some of you may have seen before. So at 0 would be no pain. At 5, it would be moderate pain, and at 10, it would be the worst pain possible. So is it okay to exercise when it hurts? You will likely feel some level of pain when you first start exercising, and that's okay. Humans are hardwired to treat pain as a warning signal, though sometimes it can prevent us from exercising. Everyone responds to pain differently. Some people stop activities completely, which can lead to more loss of function, and some people actually ignore their pain signals, which can also lead to more injury. So we want to understand that we will have some pain, but what's acceptable pain? Okay, so there's sort of two rules that you can use to help guide yourself. Okay, so I'll speak to this question and I'll continue with exercise and pain. So the question is, what about the use of the mini exercise trampoline? I'm kind of thinking that the trampoline would absorb some of the impact on the joints. That's it. Okay. So if you were to compare jumping on hard ground to jumping on a trampoline, I would agree that a trampoline is providing some shock absorption. And maybe, you know, over a period of time, if you've progressed your exercise to a point where you might be able to tolerate that, you could try that. But again, it is, even though the trampoline is absorbing some of the shock, there still is quite a lot of force going through the joint when you are jumping. So I guess my answer was a bit vague, but I would probably say, yes, it does absorb some of the impact, but it's not necessarily something that I would recommend. So you have to go by how your body feels and what you tolerate and what you like to do. And go 4 minutes? Okay. Okay, I will hurry up. So it's normal to feel a bit of muscle soreness, but the soreness should decrease within about 24 hours. If it doesn't, cut back on what you did in your last exercise session, because likely you did a little bit too much. So there's safe pain would be if we had that line from 0 to 10 in front of us. So pain scale from 0 to 2 is safe, and from 2 to 5 is acceptable. So 5 is moderate pain. So from 0 to 5, if you're within that zone, you're within the acceptable amount of pain. Anything over that is higher risk of injury and inflammation and flare-up. Okay, but you have to, everyone's different and everyone experiences pain differently, so you have to go by how you feel and how your body feels. So your pain limits can also change over time. Okay, so you know, one day you might feel a pain limit doing a certain exercise, and the next day it might feel a lot harder. Okay, so you have to go with how you feel that day. If your joint's hot, swollen, painful, you might want to rest your joint for that day, avoiding the aerobics exercise. Though again, light range of motion exercises should still be done daily. And it does take a lot to actually damage the muscles and joints, okay? And at the end of the day, excessive inactivity is usually worse than activity. I'm gonna rush through here. Okay, so how do I manage my pain? Well, you want to start low and go slow. Okay, so it's very important that you start out slowly and build from there, because having a flare-up of pain can be hard both physically and mentally. Okay, you want to ensure you have a warm-up and cool down. So 5 to 10 minutes, you're performing whatever activity you're planning to do at a slower pace, okay, followed by maybe some gentle stretching or range of motion exercises. Change your type of activity is another way to manage pain. Maybe you're having pain with walking. You can try water aerobics or biking. You might tolerate that better. Keep your joint mobile. So probably the last thing you feel like doing, but when you're having a flare-up of pain, make sure you continue your range of motion exercises. You can use heat or cold, as Rachel spoke about before. Another great way to manage your pain is to record your progress. Okay, so in order to stay motivated, it's great to record what you've been doing so you can look back and see how far you've come. There's a few other ways to manage your pain up on the slide there that you can read on your own time. That's all for today.
Thank you.
You're welcome.
We just want to make sure that we get everyone up to what they need to do on time. So thank you so much for Anna joining us, and for everyone that joined us. You will get an email following this session that has a link to the recording, so it's a lot of information. if you need to go back and watch it again or just have access to the slides. That's where you can find it. We also have a YouTube channel that I can send out the link to as well. So that has all of these lovely sessions recorded, and you can go back and visit them as many times as you need to. So there's just one last question. So the session actually just goes till 1, but I think the question was something along the lines of, are we supposed to stretch after every exercise session?
So it's important to do a warm-up and a cool-down. So a cool-down is you're still performing whatever exercise you have been doing, but at a slower pace. After your cool-down, if you are going to stretch, do that static stretching. That is the best time to do static stretching. There's still some discussion whether or not, you have to do stretching, and I don't think you have to stretch after every exercise session, but you definitely should do a cool down to allow your muscles and heart and lungs to recover and slowly come down from the exercise. I would recommend not stopping abruptly and maybe, doing some light range of motion exercises, but you don't have to do static stretching after every exercise session you do.
Okay, thank you so much. Any other questions that anyone thinks of, you can email me. My email will be sent in the follow-up email as well, and we'd be happy to either point you in the direction of the answer or find the answer for you. So thank you again, and have a lovely day.